Can everyone hear me? Yeah. Okay. Om Sahana Vavatu Sahano Bhunaktu Saha Viryam Karavavahai Tejasvinavadhitamastu ma Vidvishavahai. Om Shanti Shanti Shanti. Harihi Om Shri Gurubhyo Namaha. Harihi Om. Hey everyone. So my name is Shankarji, Shankar. I will be introducing today's topic for Vivekji. So today's topic is taking care of our aging parents and trying to view it as a sadhana. So whenever we think of, taking anything as a sadhana or viewing anything as a sadhana, essentially what we're saying to ourselves is, how can we use this responsibility, this particular set of actions as an opportunity for me to grow, for me to develop myself, to, develop more virtues and overcome my own likes and dislikes in so many different realms and areas of growth that there are. So that's what taking anything as a sadhana essentially means, is how can I use this as an opportunity to improve myself? So particularly or specifically when it comes to viewing taking care of our parents as a sadhana, there's definitely a lot of other components which we have to think about and which we need to consider. So I think one of the biggest ones to really keep in mind is what exactly is my responsibility to my parents? What do those responsibilities really entail? And I think the biggest distinction that we have to make is that our responsibility is not to make our parents happy, right? We don't really have any control over our parents' happiness. Our responsibilities are really to try and, improve the conditions for their happiness, but we, in the end, really have no control over whether they are happy or whether they're not happy. So when we're engaging in this responsibility, I think it's very important to, to distinguish that I can do my best to, provide these X, Y, and Z conditions, but whether my parents are happy or are not happy is totally out of my control and is not something that I need to concern myself with, which is, that's very difficult, to separate our parents' happiness from our own happiness. But I think that's a very vital distinction to make with this responsibility specifically. So, there's an element of what is really in our control. What are the things that we actually can do and have control over? And, how our parents react to situations and whether they are happy or not happy, what anxieties and fears they have or don't have, those aren't really within our realm of control. And it's not something we can burden ourselves with. So those are the types of things that we need to try and let go of, and because they really just inhibit our own lives, and they don't benefit us in any way. They don't help us fulfill our responsibility better. So those are the type of things that we really have to try and let go of, are how our parents are responding, or whether they're appreciating what we're doing, or whether they're anxious or not anxious or fearful. We really don't have control over those things. And I think, there's another aspect of this responsibility, and I think this is very difficult for, all children seeing their parents age, is in recognizing that, as they get older and they're not able to do the things which they were once able to do. And, it's hard for the child to see that of the parents, of someone who they love, so, and respect so much. So, another thing that I think is important for us to keep in mind is, to really reflect on this inevitable process of, everyone leaves this body, and it's just a truth of, of our world and this reality in which we live. And unless we really mentally prepare ourselves for that inevitable end, things, the progression becomes more difficult. It's hard for us to see that happen unless we're really, we really spend intentional time reflecting on that, knowing, with ourselves that, one day our parents won't be with us, and that's okay. It's the process of life in which we live in, and we need to learn to come to grips with that and accept it and slowly detach from our attachment to our parents. So with that, I will pass it over to our next speaker.
So, Poonam, you can unmute yourself.
Okay, can everyone hear me?
Yep.
Okay. And as I'm sharing my screen, you can see the full screen?
Yes.
Okay. All right, well, Hariom, everyone. My name is Poonam, and I am a geriatrician here in Chicago. I really want to, first off, kind of express my gratitude. Geriatricians don't really get the chance to talk about this topic, partly because there isn't always this chance of satsang, but also because people don't want to listen to this topic. And so I am very grateful to have this opportunity to talk to you guys today. And I hope that we continue these discussions on WhatsApp or other modes of satsang. So briefly, I just wanted to kind of mention what is a geriatrician. I'm not sure if many of you know what that is. And I'm basically a physician for older adults. So essentially 65 and older, although I will see younger people that have a lot of medical issues. And I take care of patients in the clinic, on the inpatient side, providing consultations, and also in the nursing facilities. And so I work with an amazing team. That's how I deliver my medical care. I work with a social worker. I work with advanced practice providers. I work with therapists and psychiatrists. And so we deliver care as a team. And so when I see patients, obviously, I'm addressing their medical concerns, but I'm also looking at the person next to them, the person that's brought the patient to the appointment, the caregiver. And I'm oftentimes asking them, how are you doing? What resources can I get you? And so from my time practicing and caring for aging parents, I've learned it's actually a very difficult thing. And as I'm starting this journey with my own parents, finding that it's a difficult thing. And as I've taken care of patients and their caregivers, I've learned a lot from them. I'm hoping to kind of express some of that to you today. So first off, I wanted to just do a quick exercise. If you guys have a chat box, if you could just type in the chat box, what comes to mind when you see this word on the screen, this word old? And if you guys can just type away in the chat box, we'll take maybe just a few seconds or maybe 30 seconds just to, whatever comes to mind when you hear the word old. Okay, so I'm seeing sickness, illness, decay, weak, fear, experience, letting go, needs, wisdom, lonely, unhappy, stuck in habits. Okay. I have a raised hand from Tushar Patel, but you could just maybe type it out. Fulfilled, stubborn, attachment. Okay, this is great. All right, I'm gonna flash another word up on the screen. I want you to do the same thing. Whatever comes to mind, just type it in the chat box. Wise, wise, respect, wise, wise, experience, deference, grandparent, distinguished, history, child again, timeless, leader, mentor, wisdom. Okay, that's wonderful. Mature, wise, looked up to, friend, teacher. That's great. Okay, so we'll just pause here. Thank you for kind of engaging in that exercise. I hope that as I use those two words, you kind of see where I'm going, which is in a lot of ways, the word old, it's lost. It has so much baggage with the term. It's so loaded with negativity that it's really hard to use with people anymore. And it's really how we view most people. That's how most people, view old age. So take a look at this graph. You have age here on the x-axis, and you might think, okay, so what's on the y-axis? This is how people view aging. And really, you could stick anything in here. You could stick mobility goes down with age, function goes down with age, happiness goes down with age, utility in society goes down with age. That's really what this is. Imagine living in a society where this is kind of how aging is viewed, and not only that, this is what our parents are up against, but this is also what our parents are actually thinking about. So they did a study and they showed that a lot of older people view aging just like this downward trajectory. And so, and they've shown that studies that with people that have that mentality and this view on aging, older people, that it actually decreases your lifespan. So for various reasons, either you might make poor health choices, you might feel more depression. So this is really kind of what society is looking at aging. And not only that, a lot of our parents are viewing aging as this decline as well. And so what I propose is, and what there's a small group of people that proposes is looking at getting old in a different way. For there to be a complete paradigm shift in how we view getting older, and to maybe call that something different instead of getting old, to perhaps say elderhood. And it's basically this third act in our lives. It's this act that it's not like your first or second act. It's a new act that has a lot of creativity, that has a different type of ambition, that has this protected space. And lo and behold, if we look in our scriptures, they describe this time in our life as the Vanaprastha ashram. Again, beautifully described as this protected time where we don't necessarily have all the obligations of taking care of our children, or getting them through school, or feeding our families, what we call the Grihastha ashram. Now it's truly time that we focus on ourselves. And so I really love the way that our scriptures have looked at it, because I think that's the way we need to go back to looking at it in our society. And so I just want to show you this continuum here. We've seen this before, probably in textbooks, of this baby and it's growing up and then it slowly gets older. And what I propose is that we kind of stop seeing our parents as this other group, this group that we have no connection with, but rather as this group that we are all going to eventually, if we're lucky, be a part of. And if we can connect with them in that way, it helps us it allows us to have a sense of empathy and sympathy with them as they kind of go through the aging process. It also helps us to cultivate gratitude. I think a lot of us are now in the situation where perhaps we're raising kids and we see how difficult the process is. And I know for myself, I have this newfound respect for my parents as I'm raising two little kids and kind of scratching my head wondering how they did it and how they made it look so easy. And so this exercise in terms of connecting with our older parents, not only because we will be there someday, but also because it allows us to appreciate this continuum and cultivate gratitude. I love this quote by Dr. Lin. She said, we're all old people in training. And basically what that's saying is that we just need to bridge this us and them divide. It means ditching these preconceptions we have about our parents and really looking at them, listening to them, kind of re-envisioning our place with them. But part of that is really knowing about their experience. And so I want to kind of delve into that with the basics of aging. We'll try that again. Okay, so perhaps as this is loading, I'll go quickly in terms of, what the common problems that our older parents are going through. A lot of it is, parents are starting to get into their 60s, 70s, and 80s. It's that wear and tear on their bones, right? That arthritis. They're experiencing the experience of opening a bottle, for example, is very different than our experience of opening a bottle. It can be something that simple, where arthritis of their hands, their knees, their hips makes it difficult for them to do something. There's heart disease and cancer. So heart disease and cancer are essentially the most common causes of death among our older parents. Heart disease, being a combination of genetics, but also perhaps poor decisions they may have made, those extra lead dues that they probably shouldn't have had. There's respiratory issues, there's dementia and Alzheimer's, which I'll get into because I think it's very important that we touch on that a little bit more. There's bone thinning, there's diabetes, there's influenza, we can add coronavirus to that. There's pneumonia and falls, there's depression. This time in our parents' lives is a big time of transition. Their children have now left the home. Perhaps their children now have children, they become grandparents. They're perhaps retiring, and retiring is a tough thing for our parents to do and for any older person to do. You're leaving a sense of routine, a sense of community, and you're becoming more isolated. And it's oftentimes where a lot of more health issues will surface. So depression can become common in this time. And then finally, just hearing impairment, vision impairment, all the sensory impairments that also go with aging. I briefly want to talk about dementia only because we don't tend to talk about it in the South Asian population. And partly because there is a stigma, partly there's access to medical resources. But I just want to, as children, you know your parents best and you've seen them. And so just kind of looking out for some 10 signs of dementia. So looking at things like difficulty doing familiar tasks. If you notice that they're having problems communicating, they're starting to misplace things. It's a forgetfulness that you're starting to notice that's affecting their day-to-day function. Not just the senior moments, but more significant, it's affecting their function. Maybe you're noticing they're having difficulty planning or solving problems. They're withdrawing from work or social activities, or perhaps not as social. They're starting to mix up the date and the time. Maybe they're starting to have changes in their personality, like they're getting more withdrawn. You're starting to see changes in mood or behavior, like depression. Maybe they're having poor or decreased judgment. They're perhaps spending financially where they shouldn't be. These are things to kind of look out for. It may be a sign to perhaps bring up to your parents' providers to make sure they're aware of that. So, as we're talking about our parents getting older, it's beginning to have some of these conversations about what they want their older age to look like. And part of that is, where do our parents want to age? 90% of parents, they want to age at home. They don't want to leave. But in order for that to happen, there needs to be the infrastructure there. Are there stairs in their home that they'll have to navigate? Do they have access to transportation? Do they have caregivers, whether that's family or paid caregivers? Just last year, Americans basically did about 35 million hours of unpaid caregiving. So that's the majority of the paid caregiving source at home. But aside from that, there's also paid caregivers, which as you're talking to your parents about that, $20 an hour or perhaps more or less, depending on where you live. Those are all things to really think about. Other places where our parents may want to age might be a relative's home, like one of their siblings or maybe one of their children. Also just assisted living and nursing homes. These two I'm bringing up because we think that these can be options for our parents, but financially you have to think about it. Medicare does not cover for assisted living or nursing home. So either you're paying for that out of pocket, which for assisted livings, that can be about $4,000 a month, to nursing homes, which can be up to $6,000 a month, more or less depending on where you live. And so this either comes out of pocket, it comes out of long-term care insurance, which I'll tell you, most older adults haven't put money into that. They haven't bought long-term care insurance. And then the other paying source for this is Medicaid. And so if your parents don't have Medicaid, Oftentimes they have to spend down their assets to qualify for that. And so keeping that in mind, where do our parents want to age? And then what are the resources that will allow us to let them age in their desired place where they want to age? So all of that's really important. Other things to think about, I have a chick friend who her mother and father went to India to age because that's where their friends were. That's where they knew their neighbors. That's where they felt comfortable aging. It brought immense stress to the friend, but that's ultimately what with technology, she knew she could bridge some of that distance, but that's something else. Is there another place in the US, Florida being a common destination, or even abroad? And then where do they want to age? I'll say that I have parents that want to age in their house by themselves as long as they can. And so that's something we have to kind of consider in their preferences. So I want to just bring up this concept of the sandwich generation, which a lot of us are. It's this idea, it's a generation of people that are in their 30s, 40s, 50s that are essentially taking care of their children and then taking care of their older parents. And that might be in the same house, it might be in the same city, perhaps in the same state. But it's where adulting gets really hard. It's where you feel like you're being pulled in multiple directions. And it's where we actually tend to see a lot of anxiety, a lot of frustration. It's where we stop taking care of ourselves because other people need us. And a lot of the concerns stem from the unknown and kind of feeling helpless because you don't know what's going on. And so I want to start giving you guys the tools to kind of deal with being a part of this sandwich generation so that it's not overwhelming. But not only to kind of prep you for that, but also to transform that, not so that we just tolerate being part of the sandwich generation, but that we start enjoying it. Or if we don't enjoy it, that at least we see it as an opportunity for growth. So part of that is now understanding the unknown, right? And that starts with perhaps understanding your parents' health. So the first thing that I'll say, just from a kind of a geriatrician's standpoint, is to first get involved in your parents' care. So a lot of this is, and if there's one box that you take away from this slide, it's this first box. Communicating with your parents about their medical issues. Don't wait for a crisis. These discussions are really not meant to be had in an intensive care unit. It is stressful. It is oftentimes your parents are not even in the right state of mind to be able to talk to you about these conversations. Have these conversations early. Get involved in your patient's care. The second point is go to appointments with them. Or if you're not in the state with them, just conference in. I love it when I have a patient that will say, you know what, I need to get my daughter on the phone so she can listen in on this. And I think someone mentioned, I think it was Vanita on WhatsApp, who said, overall healthcare is a mess and primary care physicians aren't as invested in my parents' care. And that's right. I would love to say that the medical system is perfect, and by no means it isn't. And so this is where you come in as the advocate, but you have to know what's going on. And that's where going to appointments or having your parents fill you in on their appointments after they're done is really important. Have a financial talk with your parents, especially regarding their savings. Do they have long-term care insurance? What resources do they have available to them? I think a lot of times our parents just, for some reason, kind of keep it hush-hush, or you never get around to having that financial conversation. Make it a point to do so. Set clear expectations about what you can provide. This is really important. A lot of us may feel that we maybe have careers that we can't step away from. Maybe we feel that we can give in other ways. It might not be time, but perhaps it's financially. But set those expectations at the beginning. And that helps kind of clear up some of the guilt that takes away from some of the sacrifice feelings that some people will have. And it just kind of keeps everything in the clear. What can you provide for your parents? Involve your partner. Oftentimes we think, oh, this is my parent. But the fact is, if you're in a partnership, it's your partner's parents too. And we don't want this to also be stressful because you're dealing with your parent, but then stressful because you're dealing with conflict with your spouse. And oftentimes I found that when I've left out my spouse, it was my spouse that had those great solutions. And so involve your spouse, get them in on the conversation. And then start discussing their wishes. How do your parents want to age and die? In this society, we're very, very scared to talk about death. That's slowly changing. For example, there's even now some cities have death cafes, which are essentially places where you can go and just start talking about death. You know, we don't see that advertised on television, but it's something that we need to stop fearing and doing with our parents. And so kind of discussing with them, you know, how do you want to age and how do you want to die? And so there are tools out there to have that conversation. And I'll just briefly discuss some of that. I'll start off by saying there's this document called The 5 Wishes. It's a booklet that hopefully some of you have seen. But essentially, it's a booklet that helps go through a lot of these things. It's a beautiful booklet, asking everything from, you know, living will types of questions, so that, you know, if are there certain medical treatments that you would or wouldn't want. But it also asks questions like, you know, in your funeral, what would you want that to look like? It even asks questions like legacy. You know, what kind of legacy does my parent want to leave behind? I'm sorry. It also is a place where they can leave messages for their loved ones, and it also might lay out information kind of as a map for successors to kind of look at. Other things that will come up, especially with the provider, are the provider orders for life-sustaining treatment, or the POLST. People may know of this as like the DNR form, the Do Not Resuscitate form. So in the case of an emergency, would you want resuscitation or not? If the paramedics come, do you want them doing chest compressions, or do you want them to let you pass naturally? So this is a document that's really important to have a conversation with your parent about. It's really important that your parents designate a healthcare power of attorney and a financial power of attorney. These are what we call durable power of attorney. So if your parents can no longer make decisions, these kick in, and they designate someone that can make those decisions. And so it's really important that if you are that power of attorney, you're not acting on your behalf, you're acting on behalf of your parents. You actually need to know what your parent does and does not want. So in addition to the 5 Wishes booklet, I'll just direct you to the website that's there, prepareforyourcare.org. It's come out of an institution in California, and it is fantastic as a way to just help through planning some of the end-of-life discussions. So, you know, let's say you get the lottery here and you get the difficult parent. And I'm putting difficult in quotations because anytime that we label a child difficult, we always give them the benefit of the doubt to figure out, you know, why are they difficult? Is it something that's going on in the family situation, or perhaps in their local society in terms of economic, or we always probe further. But with our parents, we just label them as difficult. They're difficult to deal with. And so I'm just putting that in quotations because I feel like we need to do them the due diligence of figuring out maybe why they're more resistant to your suggestions. And so, you know, what makes them resistant to want to accept help or to accept certain treatments that maybe providers are recommending? Or what makes them so resistant to want to take care of their health? That's a question that requires probing. But regardless, we may have some difficult moments with our parents. So here are some tips to kind of get through that. The first one is, you know, it's not about winning arguments, but about preserving trust and keeping relationships intact. This is definitely very relevant also in patients or in parents that might have dementia. I think that it's very important to realize that a lot of what our parents have, it's also the disease that's talking, and especially with dementia when they're losing their short-term memory. They might be saying things and you feel this need to correct them and to win the argument, but it doesn't really go anywhere. And on top of that, you start losing out on this a trust relationship when building trust is already difficult for a patient that has dementia. Instead of telling a parent what to do, ask how they would prefer to solve the problem. I think it was Sandhya on the WhatsApp who said, you know, I give my daughter more room to make mistakes than I give my parent. And that's so true, is that, you know, instead of trying to solve the problems for her parent, they're adults. They're able to make decisions pending that they have their cognitive abilities. So ask them, how would they prefer to solve the problem? And that gets to the third point, because that's about knowing their priorities and their value system. I can guarantee that if you make suggestions outside of their value system, they're not going to do it. It's almost, there's no point in doing it. But if you can do it within their value system, you'll be more successful. Be attuned to their unexpressed needs and fears. You know, our parents are getting into their 70s, 80s. They're a lot closer to dying than we are. And so they may want to put on this facade that they're handling old age well, but they may actually be fearing what's to come next. There's a lot of unknown for them. They may also be just dealing with all these medical issues. Again, they're losing their community around them. They may be losing their loved ones or friends. And so just be attuned to that. Have sympathy that this is their experience and this might be what they're going through. Be patient. Give your parent time to adjust. Whether it is losing a friend, moving to a different place, stop expecting your parents to be as they used to be. I know I struggle with that a lot, as I feel like my parents should be just as spontaneous, have just as much energy as before. The fact is that's not the reality of my parents today. And that starts allowing me to have, to give them that compassion there, that, to help me understand their situation. And then practicing acceptance for whatever the situation may be, whether it's accepting their health issue that they're dealing with, whether it's accepting the fact that they're making decisions that you think are wrong. But if you've done your due diligence and done what you can, then it's sitting back and saying, okay, now I'm going to support my parents and practice that acceptance. And then what I want to probably spend more time on is caring for the caregiver, caring for all of us here. The problem with caregiver stress and caregiver burnout is that most of the caregivers that I take care of, they don't realize they're burned out. They start noticing that their personality is changing in some ways, whether it's they're feeling more anxious, they're feeling more depressed, maybe they're feeling just tired all the time, maybe they're snapping at their children or their loved ones. Maybe they're just really resentful now. They're starting to resent their parents. They're starting to resent their responsibilities. Maybe they're drinking or eating or smoking more than they used to before, or they're neglecting responsibilities, or they're cutting back on their leisure activities. All of these could be signs that now the caregiver is perhaps not doing so well. And so it's really important to address that, because as the caregiver, if you're not taking care of your parent adequately, how are you going to caregive? And so I want to spend some time looking at how you can kind of caregive for yourself. So first is to take time. Without time that you carve out for yourself to either exercise, to eat healthy, to focus on your spirituality, you can't further your sadhana without doing that. You have to take that time. That may be stepping away from your caregiver responsibility, whether it's after your parent has gone to sleep, whether it's just stepping aside if you know your parent is in a safe situation, stepping aside and taking that time to do some active processing. Build a community and know the resources around you. And this is the beauty, I think, of technology. That community can be, as we're doing, these online communities. It can be Facebook groups. There are caregiver Facebook groups out there where people can just vent, where people can get ideas to kind of hack a situation or a problem. And then just with the internet, there's multiple resources available. So depending on what your loved one has, your parent has, whether it's dementia or heart failure or whatever, a stroke, there are resources out there, because it's really important to educate yourself on the disease. I cannot, take the time to Google it, learn what you can about the disease, because when you learn about it, you can accept it more, but you can also work around the situation. So I have a lot of kids, for example, that will come in, parents that will come in with their children to the office visit. And you can see the frustration as they're going back and forth. And, the parent will be like, oh yes, I do X, Y, and Z. And the caregiver in the back is like, no, this is not the situation. What are you talking about? And so there's this frustration because they feel like they should know what their parents are talking about. But the idea is that if you know that your parent has dementia, that this is part of the disease, it allows you to accept it. Prepare your family. I don't think we involve our children enough in the process. this is where, if you take on a lot of the caregiving roles for your parents, that might mean less time for your loved ones, your children, your spouse. And so prepare your family for that. Make sure that they're aware of that time commitment you're going to have. Just having that discussion sets the expectation and can alleviate some of the stress. Allow your parents to make quote unquote mistakes. They might be mistakes in your eyes. For them, they just might be acting in line with their values. But give your parents the space to do that. This is at the end of the world. At the end of the time, this is their life. And so when you've done what you can, perhaps you've given your input. After that, you just have to allow your parents to make that mistake. And then this last box here is what I really want to focus in on, because this is where your sadhana comes in. It's these three things. It's gratitude, it's practicing acceptance, and it's the growth mindset. And so this is where it is such an active process. It's a process. Going through this process is something you have to be doing second to second, minute to minute, day to day. And the first step is that gratitude. So kind of thinking initially, looking at that continuum, this idea that, our parents, a lot of them invested a lot of time to get us older. And for most of us, we have that gratitude. There's some people that may even have that resentment, that feel like, my parents didn't raise me right, or they challenged me. But you can still cultivate gratitude from that, because now you're more resilient because of it. So in some form or another, to develop that gratitude for your parent, because out of that gratitude will come acceptance. Acceptance of your parents' disease, of the ways that your parents are, of certain social circumstances, so things that you can't change perhaps. You're able to accept things more. And then from that, once you've cultivated gratitude, then you've built that acceptance. From there, the sky's the limit. You start developing that growth mindset. And I think we contain that growth mindset for when we're younger, when we're in our careers, when we're trying to excel, we have that growth mindset. But there's no reason why we can't apply that growth mindset to other parts of our lives, and specifically to caregiving. And I will tell you, it's the caregivers that come in with this mindset that are the most successful. Somehow they change a difficulty and they learn from it. I had patients that have said, if a parent of theirs has developed a wound on their back, they'll say, I never would have had this opportunity to learn how to treat a wound, or I would have never had this opportunity to learn about nutrition, and now I'm learning about nutrition. They've taken something that would have been mundane, perhaps just this extra task to add on their to-do list, and they've changed it and made it into an opportunity to grow. And that growth mindset is what has allowed them to be resilient in this whole process. It's allowed them to turn what might be thought of as an obligation or a duty into something that they can find joy in, that they can love. So I really, if this is another slide that you take away from this, take this slide away, because it applies to caregiving, but it also applies to being a parent. It applies to being a friend. It applies to being a member in society. It just applies to being a seeker. It is this natural progression: gratitude, acceptance, and growth mindset. And then I just want to briefly talk about, why might our parents resist your help? Because I think that's one of the most frustrating things, is you feel like you can offer these great ideas, you feel like you can offer your time, and yet they say no. And that can be very frustrating, especially maybe if you're in a different city or state. But part of it is that your parents are afraid of losing their independence. They think that if they accept your help, they're going to become dependent. And I think here is where you emphasize to your parents that all of us are dependent. We're dependent on the people around us. We're dependent on society. And so to perhaps, instead of focusing on independence, to focus on interdependence, and to relate to our parents that we all live in this web of interdependence. We wouldn't be able to live without it. And so for them to embrace it more as a way to emphasize the interdependence. Our parents might be afraid of becoming a burden on loved ones. I think that's a big one. I know my mom in particular, I won't find out about a problem until it's so far along in the issue. And so, and when I tell her, like, Mom, why didn't you tell me? And of course it's like, oh, beta, you're so busy with your kids, you're so busy with work. And so they're afraid to be a burden on us. And I think this is where checking in on them, asking them, just checking on their well-being is really important, and making that space for them in our lives. They're perhaps, afraid of being taken advantage of and relinquishing control. There's a lot of sad reality to this. There's a lot of people and businesses that do take advantage of older people. And so perhaps there is a skepticism to accept help that's given to them. But that's kind of where you come in, to check out sources and make sure that whatever help is offered to them is a legit source. And then there's the embarrassment, right? There is that South Asian male concept of perhaps being, not asking for help, of not showing tears, of being perhaps macho, if that's the term. And so there's this idea that they feel embarrassed to ask for help. And so it's also breaking down those barriers too, making sure that they feel like that's okay. So with that, that's pretty much the crux of what I wanted to say. I do want to leave some time for questions. And before I do that though, obviously I think there's been, just with the news and everything going on in the world, I think a lot of our thoughts have been very preoccupied by the coronavirus. And so I do just want to mention a few points on this. So first of all, just the general overview. Who's at risk? Our parents, the older adults in our society, they're the ones at risk. It's people with chronic diseases like lung disease, diabetes, heart disease, as well as patients that are in facilities like nursing homes. And the focus right now is on flattening the curve. And I hope people know what that means and the urgency of that message. And that basically means that we're trying to prevent the spread of this virus happening so quickly, because those people that are older and that are at risk, they might develop the coronavirus, and it might land them in the hospital. It tends to progress very quickly. And it can often cause, respiratory failure and multi-organ failure. And so that requires the hospital. And so the idea is if we overburden the hospital, they won't be able to take care of patients. And so part of addressing that is decreasing the spread or flattening the curve. And so the current strategies that we have to do that are things like social distancing. I'm a little hesitant to use that term. I don't think it's as much social distancing, it's just physical distancing. We don't need to socially isolate ourselves, as we are here with however many people on this chat. We're not isolating ourselves, but we are physically distancing ourselves. And so part of that is just making sure that we do stay away. If you're sick, to not enter society, stay out, stay in your homes. And to do good hand hygiene multiple times, not just before you eat, or not just after you go to the bathroom. It's going to be multiple times during the day. And we're recommending 20 seconds. I found that's about 2 Mahamrityunjay mantras if you chant it at a decent pace. And then in general, avoid air travel and crowded places. I know in Illinois, they just announced that restaurants and bars will now be closed. I think most physicians and people in healthcare think that's a good decision, even though it's probably going to a lot of people will suffer, especially small business owners, et cetera, but I think it's the right thing to do from a public health standpoint. And then the stockpile on supplies and medications. And I'm really just referring to the people that are at risk of getting the disease. So the older adults, I'm not talking really to all of you to take away from the resources. We've essentially done to the grocery stores what we have been telling people not to do to the healthcare system, which is overwhelm it so that there are empty shelves, and so the people that actually need that Tylenol or the toilet paper aren't able to get it. And so I'm really talking about the people that are most at risk that stock up on supplies, so that if they do get sick and they require to be kind of quarantined in their home, that they have the resources to do it. And if they don't, well, hopefully the community steps in and helps them. So these are just a few points. I think a lot of us are anxious about our parents, and I know I've put pretty strict restrictions on my parents and where they go. And so I hope you guys all do the same. I really hope that you take all of this seriously. I think there's a lot of people whose lives are at risk, not only our parents, but there's a whole healthcare workers that are out there people like us that still go, knowing that, even if we wear the masks, which are in shortage now, or gloves, or the proper protective equipment, we may still get the disease. We may still pass it on to our loved ones, but we still go. So we just hope that society doesn't act negligent and not follow these very basic precautions. Please view this as we view those three things: gratitude, acceptance, and growth. Coronavirus is our time to do that, to show gratitude that most of us have our health, to show acceptance after we've done the things that we can do, like physical or social distancing. We've done our hand hygiene, we've quarantined ourselves. After that, we've done what we can. There's this acceptance that if we get sick, we get sick. And then the opportunity for growth. We're all now here, we're doing satsang, right? People are taking this opportunity to learn a new language. I've had more time with my kids than I've had their entire lives. So I'm getting this quality time with my children. So how can we view this opportunity as an opportunity for growth? I think it was Charmaine that sent that picture about children writing cards to parents or patients that are in nursing homes, because at this point they can't leave. They're quarantining them in the nursing homes. That's the growth potential. That's the growth mindset. And so if we can use this opportunity to do that, to also kind of build our spirituality and our sadhana in this way, I think that we will be successful as an individual, but also successful as a family and successful as a community. Okay, so there's a few questions in the chat that maybe I'll start with. Can you guys hear me?
Yeah, Poonam, you can start with that. And anyone else who does have questions, if you can please raise your hands virtually. There is an option for doing that. If you click at the bottom of your screen, you'll see participants. If you click on that on the right-hand side, you would see option to raise your hands virtually. So we can queue up people for questions then. So Poonam, go ahead.
So Anasuya said, if we see signs of dementia, how do we bring this up to our parents without hurting their pride and dignity? I can imagine parents getting defensive, and that is absolutely a huge problem. Even as a provider, I can see very obvious signs of dementia, and there'll be a huge denial phase. That doesn't necessarily mean that I give up on, let's say, making a diagnosis. And in the same way, I don't think that it's worth giving up on your parents if they start feeling defensive. It's always okay to kind of step back from that conversation and readdress. Dementia it tends to be, depending on the type of dementia, is a very long, drawn-out process. So when we're talking days to months, I don't think it makes much of a difference. So it is very important to kind of go back to that point about building their trust. You can't build their trust if they're defensive. And so first, it's kind of dropping those hints, like, oh, Mom, you're repeating that. You already told me that. But that's okay. What were you saying? And keep going. But eventually you start building that list of, okay, this is now a problem. And then it might be, just bringing up to them, Mom, now I'm noticing that it's starting to affect your function. And now I'm worried about your safety, or I'm worried about, kind of put it in kind of measures that they can understand, their framework. Perhaps there's, values that are important to them. Let's say it's driving. Like, Mom, I'm noticing that this is starting to affect your driving. Maybe we should get this checked out. At least that gets you into the door to have a healthcare professional kind of make the diagnosis. So it goes back to kind of, it's okay if you can't address it in that one conversation because they're getting defensive. Readdress it later. Start building up a list of issues that you're noticing, and then put that all in context of their values. What are things that are important to them? Spending time with the grandkids, like, Mom, I noticed that I'm a little worried with you around the grandkids. I think we should get that checked out. Again, it's their value system. Let's see. So Deepa Salem said, question for later. Mother refuses to wear her hearing aid, frustrates Dad and all of us, and makes her feel left out. What can we do in situations like this? So one of the biggest things with hearing aids is that they can be very uncomfortable. So it's always important for them to work very closely with an audiologist to make sure that they're fitted properly. Second of all, hearing aids, aside from being uncomfortable, they have to be actively put in. And so it's also reminding your parent, like, if there's a grandchild, like this grandchild really wants to hear your stories, or really wants to, you're too loud around the grandchild. So again, put it in the context of what they enjoy or what they value. Especially grandkids are a good way to kind of, at least I've noticed for a lot of people, to get their parents to do something. So again, put it in the context of their values. I mean, ultimately, if you've tried a bunch of things that she doesn't want to wear it, ultimately there's going to be that acceptance. I will say that there are reasons also to wear your hearing aids, including there's increased rates of depression for patients that can't hear around them, and increased rates of cognitive impairment. So perhaps that might be incentive. You know, if your mother doesn't want to head towards the depression or cognitive impairment route, this is a way to kind of reduce that risk by wearing their hearing aid. So put it in the context of perhaps her health. Mother refuses to take her medicine, says Vanita, and there's only so many times everyone can remind her. That I think just requires a lot of probing. So definitely the question of why does she refuse to take her medications? You know, is it just the fact that she's forgetting? And so now instead of her being non-compliant with her meds, it's more an exploration of, okay, is there maybe some undiagnosed cognitive impairment? Is it that there's maybe so many medications that she needs to have a conversation with her doctor about polypharmacy? 12 medications is too much, and you know, she feels like one of them is causing side effects. She doesn't know which one, so heck, just not take any of them. So there's a lot that could potentially be going on there. Again, you may get to a point where you've kind of exhausted all the possibilities of why they're not taking it, and ultimately they're not taking it for a reason. I think it goes back to what Shankarji said at the beginning of the talk, which is then you got to separate your happiness from your parents' happiness, and maybe let that one go. And it can be very hard, because that one in particular might mean that some of their chronic diseases are not being treated properly and maybe puts them at risk for something else. But ultimately, if you've ruled out everything else, you've explained that to them, you've tried everything else, you're going to perhaps have to separate from that goal of actually happening. Are you able to start with the questions on the chat group? Okay, so that I'm doing. Are there any lifestyle changes to slow down or reverse dementia? And that is a great question. It is the same things that are going to slow down or prevent your any cardiac issues or to slow down or any risk factors for stroke. So that's things like eating healthy, that's things like exercising, those very common things, because those are the things that actually make you more at risk for developing dementia. There's a type of dementia called vascular dementia, which is the second most common type of dementia. That's very prominent in people that have had strokes, that have had heart attacks. And so those are, so again, healthy eating. And there's something called the MIND diet. It's a mix of the DASH diet and the Mediterranean diet. So things like berries and cutting out fat and stuff like that. You could Google it. It's called the MIND diet. So healthy diet, regular exercise, things like drinking and smoking, smoking cutting out completely, not drinking in excess. What we kind of feel are very, common sense things, but are very difficult to get to when you're part of that sandwich generation. Those are ways to slow or reverse dementia. Reversing dementia is, unless it's a reversible type of memory impairment, which is pretty rare, it's very hard to reverse dementia, but at least you could slow down the progression. Let's see, sometimes parents expect us to take care of them in the place that they are in, but this is impossible since we are in a different country. How do we resolve this conflict? They do have their siblings around, but their expectation is I have to be physically present near them. This is a really difficult one. And I think it goes down to just setting your expectations. And I think doing what you can to basically make two groups happy. Again, part of that sandwich generation. So knowing that you have this obligation to perhaps your family that's here in the country. And so perhaps being resourceful. So if you can't physically be there, there might be some guilt that you have. So you're going to have to work through that guilt because if it can't be done, it can't be done. But then put that growth mindset in place. Are there things that you could help your parents' siblings with, your aunts and uncles? Can you send them money? Can they help you be present for visits in that country? Can you help them with resources that we have here, whether it could be a pill box that you send to India, or a blood pressure cuff, or anything to kind of make their healthcare go properly over there? What can you do from here? And then ultimately, it's going to be working through that guilt. If you can't be there, you can't be in two places at once. Your children may need you, your spouse may need you. And so it's kind of working through that. And then once you get past that guilt, you can be way more productive. Those are all the questions I see on the chat. Anyone else have questions? There's some good resources that are being supplied through the chat. I'll give an example. This is a patient that I saw last week. It's an older lady that has dementia. Her child, her son, who's older himself, he's a retired Chicago police officer. He worked his entire life in the police force. And so a couple things that came out of my conversation with him was, first, that he's burned out. And he noticed that he was talking to his mother the way that he would talk to someone that he had just arrested. And so he would get really frustrated. He'd yell at his mom, like, "Why are you repeating this? I already told you." And he was starting to resent his mother, resent his family, resent his life. And so he had a lot of insight. He said, I treat my mother like I treat some of the people that I have convicted in my life, and it's not fair to her. But then he said something. He said, I've worked my entire life for retirement. I finally retired. And here my mom is needing my support 24 hours. It was really heartbreaking to hear that. He was in tears. This is a Chicago police officer. He's very rough and tough. And he's in tears. He's saying, like, what about me? Like, me and my wife, we were finally going to go on these trips that we had planned. And here we are taking care of my grandmother, or I'm sorry, his mother. And so it was helping him through that process. It was trying to find him resources. For him, he realized that he needed to put his mom in assisted living. So a place where she could be independent. She was very sassy herself and wanting independence, so it kind of worked out for the both of them. But it allowed him to also kind of live his life, although he talks and visits his mom daily. It allowed him to kind of not be in conflict with his spouse. He had a lot of guilt over putting his mother in an institution, but he kind of realized at that point that was what needed to be done. But this is tough. Being in the sandwich generation is really tough. And I really hope that we turn to the satsanga on our phones, the WhatsApp groups. We turn to each other. Please know that you have a geriatrician now that you can kind of resource if you need to. We're kind of a rare breed, so I'm happy. I did have my email, but I'll leave my email somewhere. Feel free to email me if you have a question related to your parents' health. I'm happy to help with resources. So. Well, there's a couple of new. Oh, no, I think that's it. Oh, wait, sorry. So Pooja said, when you look at the elderly you serve that are happiest and most successful, what are the common attributes? Oh. Okay, so I'm assuming Pooja's asking about, the ones that are successfully aging. Is that right, Pooja? I think, yeah. And I'll say that these are people that, I hate to say it, they had the growth mindset from the beginning. These aren't necessarily people that are like educated, or these will be, for example, maybe an older woman who took care of like 6 children. She never had a job. Being a stay-at-home mother was her job. And yet she has, no medical problems. A lot of this could be genetics too. But it's also the fact that she has taken all of her challenges in great stride. She laughs at challenges. She welcomes challenges. I find that those people, time and time again, are the ones that are most successful. They also will tend to use humor. I feel like the ones that age well tend to be lighthearted about things. That kind of goes back to the acceptance. They tend to accept a lot around their world. And oftentimes, you know, it's not, they try to change what they can, but I think they realize what they can't change. And after that, they kind of have that acceptance. So those are kind of the common themes that I've seen. I'll also say that they have a very good social network. If it's not family, like their children are not in the picture, they've replaced that with friends. They have very, very close girlfriends or guy friends that they meet with. One of my patients just told me about the Old Farts Club. It's basically a group of old men that meet at McDonald's and they get coffees and they just joke around. And he loves it. And he'll say that, you know, sometimes they lose members because people are dying, but he says, you know what, the rest of the group, we're able to stay intact. And so community is a big one. Anisha says, how do we address depression in grandparents when it's difficult to address in any age group in Indian society, especially if these emotions come from losing a sibling or not having immediate family nearby? I've heard on multiple occasions, I don't have anything to look forward to. Yeah, that's a really, really difficult one. And I think that's oftentimes when they start losing siblings, when they start losing friends, the first important thing is just to make sure that this isn't just an adjustment disorder. So this isn't just them adjusting to losing out on someone. This is also where they find that they're starting to address their mortality, and that's very normal. When you lose someone, it's okay to start thinking about your death. When that starts debilitating you, that's a problem. But when that starts maybe perhaps, you know, helps you with starting to talk about the planning process, when that starts making you feel maybe a little more comfortable with talking about death, then again, growth mindset, you can turn that opportunity or that tragedy into an opportunity. And so it is difficult to address in South Asians. I think that stigma we're going to have to keep fighting as a group. But I think that at least they can individually even address that with people they're comfortable with, if not in their family, even with their healthcare provider, to maybe just say it. And that's something that most of us do. We do screen for depression. For me, at least, almost at every visit. How can we help our elders deal with the loss of their spouse? So another very, very challenging thing. And I think this is oftentimes where people start losing purpose. For a lot of women outlive their spouse. And so it's where they oftentimes have to figure out how to live on their own. They maybe realize how dependent they were on their spouse or family. And a lot of this is just helping them grieve. Grieving can take a long time. I think my psychiatrist colleagues could probably answer this better, but it starts to be abnormal when it's usually longer than a year. It's okay to cry about losing a loved one or to kind of be with that emotion. And oftentimes that's what we're doing in the office. I'm saying, tell me about your spouse. Like, what were they like? And it will oftentimes elicit a lot of emotions, and that's okay. But I think it's helping them focus on not being debilitated by that. And so making sure that they understand that they still have a life to live. And so how do they kind of pick up the pieces and find a new purpose in their life? And that's absolutely where family comes in. That's where perhaps this is oftentimes where they'll then move in with a child. And sometimes just having those younger kids around or having those additional responsibilities that you give them, that you give intentionally just to kind of give them purpose, that's where it becomes really helpful. How can I avoid being accosting when trying to show my parents that they can't do everything they thought they could with the arthritis and knee injuries? I want to say sometimes, see, I told you so, see what pain you are trying to do to yourself. But that tends to start a generally negative conversation, however well-meaning. That's a good point, Vijay. I think that I'll kind of go to some of the parenting techniques, which is, if your kid can't do something, it's rarely ever productive to say, I told you so. Like, see what happened. And oftentimes just kind of breaking it down for your kid. And I think it's not very different for your parent. And so kind of helping them through that conversation is important for them to see kind of, okay, here was the cause, here was the effect, but not doing it in a demeaning way. And so just, again, give your parent that compassion and that space to make errors. They're people, they're humans. they're as new to this aging process as anyone, because they haven't done it before. And when we're in that position, we're going to be doing the same thing. We're going to be navigating this, probably using a lot of Google compared to them, but we're going to be navigating this process. And so just give them that, let them make mistakes. Injuries for the most part heal, and they're more than likely won't repeat that injury again. But just do your best not to belittle them, and just kind of help them through this situation, given their value system. I've seen a lot of ads of the over-the-counter meds that provide memory support, such as Prevagen. What are your thoughts on these over-the-counter medications? I will say that the evidence for these medications are not good. In fact, I will say the evidence for most of the medications, the ones that are prescribed, are also not very good. And this is where we are looking towards our fellow scientists to come up with good, innovative drugs that we can offer our patients. Prevagen is not it. There perhaps could be a little bit of a placebo effect, but I oftentimes find that when my patients are taking 15 other drugs, I want to prioritize the drugs that are going to control their blood pressure, that's going to control their cardiovascular risk, because you know what? Controlling that is going to have more of an impact on their cognition than adding a different medication. So I don't encourage it. I will say, and the other thing, especially for my patient population, is cost. Even if this bottle of supplements is $30, $40, that's $30 or $40 they're not spending elsewhere, maybe towards savings, maybe towards copay for other drugs. And so I'm very hesitant I never recommend it, but if a patient comes to me and they'll show me this ad, I will go through the pros and cons with it. I would say the cons, there's not a lot of risk to these medications, but again, the benefit's not that great. I focus on other medications that actually do work. Any other questions? So from Tushar, besides Google, are there any other medical resources that you as a geriatrician recommend for educating yourself about elderly diseases or helping elderly parents? Yeah, so that's a great one. I think it's also dependent on the medical issues that they have. So if they, for example, do have dementia, the Alzheimer's Association is a fantastic resource. I found that AARP is also another great resource for parents. If they have questions about, like, should I still drive, you could put that into AARP, and they have really good resources about, well, should you be driving or should you not be driving? So that's another good one. There's a John Hartford Foundation, which it's geared towards healthy older aging, so they have a lot of resources as well. And I'll just touch on also, most of your parents are probably not seeing geriatricians. The medical system is built so that if they're seeing a general practitioner, so that's either an internist or family practice doctor, they probably are getting 15 to 20 minutes to see that provider. And so this is where you can help your loved one, your parent, come up with a list to help prioritize the visit. So if memory issues are on the top of the visit or as a priority for you, you have to bring that up. So make sure you help your parents come up with a list, because otherwise they won't get to it in a visit. And that's where advocating for your parent is really big. If your parent has a lot of medical issues or does have memory issues, I do recommend seeking out a geriatrician. If they have memory issues or dementia, also a neurologist is a good resource. Pooja is saying also check out my Instagram. I have an Instagram handle, the geriatrician, so I put some resources there as well. But that's tough. It's tough because you think that the healthcare field has all the answers, and it's just the way that our healthcare is built. There's not a lot of interfacing time with the physician. And so oftentimes the diagnosis of dementia is very, very delayed, because in those 15 or 20 minutes, our parents can put on a show, they'll chit chat, they'll, talk about, do some small talk with the doctor. Next thing you know, the visit's up. And so they're not picking out on those 10 signs because it's just not coming up in the visit. So unless sometimes you do testing, or unless you have a loved one there who's saying he's forgetting things, or he drove, he was supposed to go around the block, he ended up in Wisconsin. Unless you have people saying that, it might not come up in the visit, and that's where a lot of delayed diagnosis happens. And that did happen. I had a patient that, like, the spouse, like the patient never came back, and the spouse called the police, and instead of being in Chicago, the patient ended up in Wisconsin. So it happens.
There is one question by Ricky, so I'll just unmute him.
Hello, can you hear me?
Yes.
Okay. First of all, Poonam, thank you very much for a beautiful talk. Very interesting and very useful and very informative. Two questions. One is, what is your guidance on parenting as siblings, and especially when you and the sibling may not have the same view of dealing with the parent? Um, and also to add on to that, if you're not the person where the parent is staying with. So that's one. And the second one is, how do you deal with remote parenting? So in the sense where the parents of you or your spouse are not in the same country, how do you deal with that when you're so far away?
Yeah, so as far as sibling parenting, so first it comes down to which of the siblings' values are most in line with the parents, because ultimately when it comes down to it, the person that's going to be the most successful is the one that is most in line with the parent. I found that if siblings can kind of divide their roles, so one be more in line and kind of dealing with the parent's health, another one with the parents' every day-to-day living or financial, it helps to just kind of separate so there's not a lot of overlap. And this is where I then tell the parent, like, can you designate someone to kind of deal more with your health or to deal more with your finances? Ultimately, I think, obviously the siblings have to come to a consensus. And that's where kind of thinking about what's best for your parent is what should be kind of your focus. I know amongst my siblings, my brother will have one opinion, my sister another, and myself one. Will give it all to my parents. And though I think I have the best advice, they default to my brother, and I think Pooja will probably agree with that. And so we've noticed that sometimes if I want the message to get through, do I talk to my mom about it? No, I go through my brother. And so we have our techniques too, because, and so kind of hacking the relationship that you have with the parents helps too. So hopefully that answers the question. And then as far as remote parenting, it's very, very difficult. And that's why I say use technology. I would say, again, conference into your parents' visits with the healthcare provider, if they let you. And part of that is just to kind of say, yeah, I'm going to kind of help you keep track of things. These visits tend to be very short anyway. And so they can keep you on conference call. And so if there are certain things that are recommended, you can then use the healthcare provider as the person to then use to get them to do things. It's not you, it's, oh, the doctor said this, the doctor recommended this. And so just try to get involved in your parents' care in that way. Use technology as well. And like I said, if you can't be there, it's, it might be just kind of setting up your parents' home. I have a few patients that have dementia. They're not quite to the point where they need 24-hour supervision. And so the parents have set up security, or the children have set up security cameras, a Nest in the house. And that just allows it, obviously with the parents' permission. And so that allows you to kind of monitor, make sure they haven't fallen. You can keep track of your parents. So I would say use technology to the fullest. And now I feel like so many families have come up with innovative techniques, kind of use that growth mindset to come up with new ways to do that. And so there's a lot of support groups and different channels where you can find out what those technologies are. Someone asked about Lumosity. I would say more so. So Lumosity is a type of, it's like a website where you can do like memory games and stuff. And I will say that having your parents in front of a screen versus having your parents do social activities, to have an interaction with a friend or with a stranger, or it uses so many parts of your brain, from your executive function, memory, everything. And so they're better off perhaps engaging in satsang or engaging in the Chinmaya community, whatever community they have, as opposed to being in front of the screen. There's a lot of Indian parents that will sit in front of the TV and watch CNN all day. Like, I don't think that's useful. I think really kind of focusing on those relationships, because also it's twofold, right? It's you're using your brain to create that relationship, but that relationship becomes your community when you need your help in the future. You're better off investing there than paying for these lumosities. So no, as a geriatrician, I don't recommend it. There was one other point I wanted to make, but I forgot. So. Any other questions? My mother-in-law is on this call, so I'm being careful. Hi, Mom. Any other questions at all? Again, feel free to email me. Please be safe. Pooja. Or maybe I'll go with Seema's question first. Seema says, how do you handle a parent who thinks they are invincible? They seem like they can do it all, and they do, but later you hear from someone closer to them that they have aches, pains, they're not disclosing, or all their health issues, or they're hiding a lot of their health issues. That's a tough one, because on this pathway as parents, they're kind of going through their sadhana, right? They have their egos they're dealing with, they have their pride that they're dealing with. So some of this is figuring out why they want to seem invincible, and making them understand that they're going to lose out on a lot of help that way. Part of it is building a community with their community around them, right? I have a lot of patients that will use neighbors to help them keep an eye on their family. And I think this, in the same way, you can kind of use these friends that are reporting, be very, transparent with your parents, saying, I'm going to check in with this person. And if you're telling them you're in pain, like I want them to tell me, because I want this to be an open relationship. But part of this could also requires reflection. Like, why are they not telling me? And I noticed my mom used to do that a lot with me. And I realized it was my immediate reaction, like, Mom, it's because you need to do X, Y, and Z. My immediate reaction was never to actually listen to her. It was to immediately provide feedback to her, or suggestions, or ways to fix it. And so then she closed off. She didn't go to me. She went to my brother. And so in the same way, I think, do reflect on yourself in terms of, why are they not sharing that with me? There may be a reason. Supriya says, how do you encourage parents to participate in social activities when they don't usually prefer socializing? And that's true. Socializing may not be everyone's cup of tea, but it's doing whatever is in their comfort zone. So that may require a little bit of discussion with your parent. Now that they've retired, their life looks way different. They actually might not even know what to do with themselves. And so there's going to need to be that exercise, like, okay, you're maybe not on the best trajectory for your health. Like, how do we get you back into a gym class? Or maybe just signing them up with their permission for a yoga class or an exercise class. So some of this might be just kind of figuring out, okay, what's lacking in their lives. If they're able to agree with you and give their permission to help even just connect them with those activities. Sometimes there's this huge activation barrier or activation energy that is needed for our parents. And sometimes if you help them over that hill, it automatically allows them to kind of do things. So yes, are we enabling them in some ways? And a lot of them will refuse to help because they're saying, oh, I'm going to be dependent on your help. But sometimes in some situations, it's okay to help them through maybe connecting them to resources. And then just socializing isn't for everyone, but can they socialize in different ways, like talking to grandkids on an iPad, or volunteering for something, or going to baby group, or doing Bhiksha, or going to study group classes, or doing these classes online. I see some of my relatives that are on, it doesn't matter if you're older, use the technology. They can learn. It's going to take you some time to teach them, but they can learn. To piggyback on Sabria's question, my parents are socially isolated because they moved and a lot of their friends have passed away. Absolutely. And this is where I'm going to plug my social worker colleagues. I cannot deliver the care that I deliver without my team. And I have a social worker that will meet with the parent or the patient and help them connect to resources. So I will say that a lot of what she does is oftentimes a Google search, so putting in a zip code and finding out what's around them. So that you can do, but if, there's a lot of also information that my social worker has access to, whether it could be programs at a local university. I know at my university, we have a whole generations program where they do all this different type of programming for older adults. And so if you can find a social worker or case manager in your area or through your physician or provider, then that's another way to perhaps get them connected. I think Chinmaya Mission is such a wonderful thing too. I don't know where Srinivasa's parents live, but is there a Chinmaya Mission near them, or some temple, right? Temples are communities. Is there some type of group in the temple, maybe cleaning the altar, or things that they can volunteer with that will automatically put you in touch with other people? Oh, Delhi. Okay. So, I guess I'm not as, I don't know exactly what resources in Delhi are. So it's just not my expertise. So I may not comment on that, but I could help you do a Google search after. Or better yet, if there's other, chicks or CSKs that have parents in India that might know about resources in India, please connect with Srinivasa and I can't read the full other name, but please connect with them. I mean, you guys are probably better experts about India resources than myself.
Poonam, I just wanted to say thank you so much. I guess we're done with all the questions. Just a huge thank you from the entire Chinmaya Setukari West team, and we had our largest audience today, so thank you so much. The session's gone like well over 20 minutes, so I think this is such an important and relevant topic, so thank you so much for all your expertise and all your passion as well. And you're going to get a bunch of new followers on Instagram, I'm sure.
Awesome.
Thank you, everyone, and Hari Om, and please do tune in to our next workshop, which will take place next month. All the details will be posted on all of our social media handles. Thank you. Hari Om.